So welcome back. Welcome to the Dr. Paul Show. I want to talk briefly about homelessness. This is a subject that's pretty common. I mean, I live in California, where the homeless problem has just been getting worse and worse. And it's not only in California; it's all over the country. But it's increased in certain areas. In California, it's more because of the weather. A lot of homeless come from other states because it's hard to be homeless when it's freezing, and even when it's too hot, like in Arizona or Nevada. So a lot of people come to California because of our weather is so nice, and that they can be homeless and survive outside. I mean, sometimes it's some like a mom and some kids, they can't afford rent, but that's a rare case there. But that does happen. But that's usually a brief case, and they usually get help, and there's help out there for them. The majority of homeless people have two issues going on. They have mental health issues and they have addiction issues. And it's hard to separate those two because addiction travels right with mental health, and mental health travels right with addiction. So addiction is really self-medicating an underlying mood disorder. So, and the problem is then with the street drugs that are out there that are so highly addictive, the people get on them and they can't get off of them. They get on fentanyl, and if they don't die from it, and if they learn how to do just enough so they don't die, it's very quick, but it's very short acting. They have to do it again and again. It's very cheap too. But then the problem is, how do they get money to pay for this stuff? How do they get money for food? Well, they either eat out of dumpsters, they crime, they steal, they sell their bodies for money. So it's a pretty grim situation, but there's hope. But the problem is that we don't get to the underlying cause, and if you just keep throwing money at a problem, like in California, billions have been spent on homelessness, and it's just been increasing. So it's been a lot of money wasted. But what we really need is get these people into rehab, get these people into mental health facilities. That's the way to get them off the street. Is you got to treat them, and if we don't treat these people, they're going to just stay in their situation. There's a very high mortality rate. A lot of them die. They have a lot of early deaths with homeless people. They get because they have medical conditions that they don't treat. They get infections that get worse. So they're a very high risk population, and it's a very sad situation. But there's hope, and the good thing is that there's hope for these people. But they need help, and they need to be sometimes forced, in a sense, to say, look, you need to get into this facility. There's a lot of charities out there that can help. Also, like I said, we can't always rely on the government because the government isn't really always the best for helping people. They're very inefficient. They waste a lot of money. So, but there is hope, and so if you know anyone who struggles with homelessness, and you want them to get help, contact me, and I can see what I can do. And sometimes, like I said, I've seen homeless patients in my practice, and sometimes just treating their underlying mood disorder gets them better, because then it helps them beat their addictions, and then they can live productive lives. I've had patients who've been homeless, and they no longer are because they got treated properly. So again, if you want to read more in my new book, The Corona Protocol, I have a whole chapter on the subject. And if you like this video, please like, subscribe, and share with your friends. And if you know anyone who needs help, have them contact me.